I'm Dr. Todd Linsenmeyer. I'm the Director of Urology here at Kessler Institute, primarily working with our spinal cord injured patients as their urologist. After a spinal cord injury, one of the major issues actually is their bladder management.
One night I was out riding a mountain bike with a friend of mine. Went down a hill, we leveled off, and next thing I knew, I landed on my head.
I was on vacation in the Bahamas with friends from my fraternity. I subsequently dove into shallow water and fractured my C4-C5 vertebrae, resulting in paralysis from the shoulders down. I've dealt with my physical disability ever since.
There are 100,000 patients who are suffering from spinal cord injury who are permanently catheterized. These patients often develop blockage and incrustation due to a bacterial infection that leads to bladder stone and sedimentation and biofilm that blocks their catheter.
We had a nurse come in for a little bit in the beginning to help us learn how to change the Foley catheter. While she was doing it one day, we couldn't get it back in, and I had to be rushed to the hospital.
There are many advantages to an indwelling catheter for people with a upper motor high-level spinal cord injury. It can be a real godsend for them. But there are some problems, and probably the most common problem is incrustation and forming of stones. The other problems that can occur, and almost somewhat secondarily to that, is the catheter getting blocked will then cause the bladder to get stretched and cause infections. It can cause autonomic dysreflexia.
If you ever talk to a person with spinal cord injury, they know autonomic dysreflexia is the nightmare. Imagine a migraine, but 10 times worse for several days.
The day I was rushed to the hospital in the beginning was a headache I know what it can feel like, and I don't ever want to feel that again. So there's silent ones too, where I'm sleeping, and if it blocks during the night when I'm in bed, it's almost to the point where it's too late when I wake up. My head, I can't even move. I have to yell like, "Glor, I got major headache, something's going on," and of course it's a blockage.
This morning we announced the results of our urology clinical trial that's focused on developing an irrigation solution that has the potential of preventing blockage and incrustation.
If a product is out there that could reduce my current bacteria even further, I think it would really be part of an improvement in life.
The study that we did that I did for NovaBay, the rinsing, etc., we believe that helped tremendously.
Yes.
Because after the first study, I think it was 6 months before we even found another bladder stone. We know we'd be willing to have a rinse at home, and that would help tremendously. And peace of mind on top of all that would be incredible.
We really don't have real satisfactory ways to manage bladder stones. Carl's a good example that we just do the best that we can, but we really do need better ways of management for this problem.